Hey there, and welcome to the second episode of my NugFit YouTube. I'm so glad to see you back here. And today we're talking about abs, core, diastasis recti, and modifications that you can use during your pregnancy. Before you start any workout routine, whether you're pregnant or not pregnant, you should really consult your doctor. So make sure that you get the okay to do anything, whether I suggest it or you find it online or you're just doing it at the gym. Make sure that your doctor knows about it and said that it's okay. Okay, so there's so much to talk about when it comes to your core and your abs in pregnancy and beyond. Okay, so my first pregnancy, there was literally nothing out there except for some really easy exercises that I felt like weren't helping me because they were more geared towards beginners who were just starting to try to work out during their pregnancy, which there's nothing wrong with that. And I will definitely show you some of those moves as well. If that's you, that's perfectly okay. But for me, trying to actually like adjust and modify as I went, it was a little frustrating not to find something that was geared more towards an athlete. And I'll get into that momentarily. So let's talk about your core and your abs and diastasis recti. So when you're pregnant, your body really depends on having a strong pelvic floor and strong abdominal muscles to support your pregnancy, your belly, right? So a scary phrase that you hear, and I've mentioned it like 3 or 4 times now, is diastasis recti. So what is that? It's a separation of your abs. First of all, it happens to everybody. Every single pregnant person will experience diastasis recti. It's when it comes back together that sometimes you have problems, okay? So do not get freaked out by the fact that as your stomach is expanding, that your abs too are expanding and coming apart, right? To make room for that baby. So it's a beautiful thing. The problem is after you give birth, if your ab muscles are weak and your core is weak, sometimes these fibers tear when they're separating, and when they go to come back together, they don't come back all the way together, so you have a space here. And what can happen is your intestinal tract can poke through, like a hernia. It's essentially a hernia. And it usually is about your belly button, maybe a little higher, maybe a little lower. If you're recently postpartum and you're trying to figure out whether or not this is an issue for you, but you feel like it might be, I was totally like paranoid that I was gonna have this, and I was like always getting checked for it. Lay down flat on your back, take 2 fingers right here, and just place them right above your belly button and pull up a little. And if you can feel a separation there, then you might have a little bit of a separation, but don't trust that. That's like an at-home method. If you really are concerned, please go see your doctor. And there are options if you are, I mean, some of it's really noticeable, some of it's not noticeable. If you have diastasis recti and your intestines are hanging through your stomach there, yeah, you need to go see someone. Do you need surgery? Possibly. There are surgical options, one of which is, and remember, I'm a teacher, I'm not a doctor, so I'm giving you like the layman's term of this. So one of the options is they do surgery. It's like super minor, I believe. And then they just put in like a little mesh panel here that keeps your intestines in. It doesn't really bring your abs back together, so to speak, but at least you have like something here keeping your insides from the outside. Your other option, physical therapy. Physical therapists who specialize in postpartum recovery are a great resource and can show you some exercise that will help you bring those abs back together and repair those broken fibers. So that's a great non-surgical option. Google around, ask your doctor, ask your friends, see if you can get a recommendation, depending on where you live. So this happens to everybody, okay? It's just the coming back together that might be a little problematic for you. Wherever you are, it's okay. It can be fixed if you want to fix it. If you're cool with it, let it be. But I know sometimes it can be a little unsettling to hear things like, oh my God, my intestines are going to hang out my stomach. It's possible. But remember, you just pushed a baby out of a very small part of your body, or you were cut open and it was taken out. So, anything's possible. And that's pretty amazing, and it's pretty powerful, and it's pretty awesome. So you should be really proud of yourself, whether you've given birth before. If you haven't given birth yet, it's a pretty amazing experience, and it just shows how tough and awesome you really are. Okay, so exercises while you're pregnant. What should we be doing versus not doing? First 8 weeks, if you're an athlete, if you consider yourself a regular CrossFitter, you're drinking the juice, you're out there lifting every single day, by all means continue. There's no reason for you to stop doing what you're doing unless you experience pain, discomfort, spotting, or anything like that. And again, talk to your doctor before you do any of this. And of course, if you have any of those symptoms I just mentioned, definitely talk to your doctor. 8 weeks. That's where you really need to start monitoring your twisting poses. So anything that's bringing you to crunch like this or like this, specifically in yoga, like side crow, anything where you're turning and twisting, you want to stop doing that then, okay? So no more. No more. cut that out. Alternatives for your second and third trimester, lots of planks, cat-cow. We have anything that is avoiding crunching up in this area or twisting, okay? Because when we talk about diastasis recti and our muscles coming back together, there's two things that can be problematic. Either your core is not strong enough, or you did too much exercise and the wrong exercises, and it damaged your abs to the point where they can't come back either. So there's a happy medium somewhere right in there. That is our goal, to hit that. So we have a strong, solid core and pelvic floor, but we're also not overdoing it with the wrong exercises that are only going to inhibit the recovery process. So stay tuned. And what I have for you at the end of this video, so I'm wrapping it up here, is some modifications that you can use first, second, and third trimester for your abdominal workout to strengthen your core and to help you have a happy, healthy, and safe delivery and recovery process. Stay tuned. Hey, so today we are talking appropriate ab modifications for while you're pregnant and a couple of moves that you can do. So here we go.